Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande from Pune, Maharashtra State, would like to welcome you all in this class. This is the class related with the subject striroga and Prasuti Tantra. But you may be understood that paper 1 is related with the Prasuti Tantra, delivery, pregnancy, and paper 2 is a physiology and pathology of the female body. You understand? So paper 1 is related with obstetrics, prasuti tantra, pregnancy, delivery, etc., etc. And paper 2 is the gynecological problems related with the female. The most important, just now my student has mentioned, that is Yoni Vyapad. Vimshanti Yoni Vyapad, 20 types of the different gynecological problems. That is the most important topic from the paper number, yes, 2. Now, I would, as a part of revision, this is paper 1 that we are discussing, paper 1. Okay. So, I will read the important points from the syllabus once again for you. There are total 10 points. My dear friends, open your notebook to write down the date. Come on, come on, come on. 28 November 2023. First, you can write down the topic. Before I go further, you just write down this topic. I will read for you. Garbha Vyapad. This is the main title. Garbha Vyapad. Complications of pregnancy. Please write down. I will wait. Garbha Vyapad. Can you see the cursor? Garbha Vyapad. Vyapad means complications. Complications during pregnancy. Okay, this is Garbhasrava, miscarriage. Write down immediately, miscarriage. Garbhapat, abortion. Shosha, nutrition is not proper. That baby inside the uterus, Shosha. Okay, Kshaya, nutrition is improper. Then Upavishtaka, some Sanskrit words are there. I will explain what is that Upavishtaka and Nagodara. But these are very important topics because these SAQ describe what is Nagodara, describe what is Leena Garbha. These all the questions are very important for examination. 3 words are important: Upavishtaka, Nagodara, Leena Garbha. I will wait. You write down everything. Garbha Vyapad. Because further you may not write. But this, what Dr. Deshpande has told on the 28th November. So this topic, Garbha Vyapad, complications of pregnancy. Number 1, Garbhasrava, miscarriage, bad luck. Garbhapat, abortion, bad luck. Shosha, Kshaya, undernutrition of the baby inside the uterus. Upavishtaka and Nagodara, Leena Garbha, and Antah-Mrita Garbha. Antah means inside the uterus. Mrita, dead. Intrauterine death of the fetus. IUCD. Sorry, IUD. Intrauterine death. Please write down. IUD. IUD. English capital IUD. Intrauterine death. Of whom? Of what? Of that baby. Bad luck. So these are the complications. They are like a bad luck for the pregnant woman. So we will see one by one. Before that, I would like to tell you the 10 important points from paper 1. Paper 1 is related with the Prasuti Tantra. Prasuti, delivery. Number 1, Garbha Vijnaniya. Garbha, fetus. Garbhadhan. Garbhasrava Garbhasamagri. Garbha masanumasika vriddhi, every month. Masanumasika vriddhi. Apara nirmiti, placenta. Garbhodak, udak, water, amniotic fluid. So we have discussed the points from Garbha Vijnana, second chapter. Second chapter, Garbhini. Garbha, then Garbhini Vijnani. Garbhini means pregnant woman. Garbhini, pregnant woman. So Garbhini Vyakhya, Vyakta Garbha Lakshana, Vyakta Garbha, Garbhopaghat Karbhav, Garbhopaghat Karbhav. In my classes, I have taken these already, uploaded video are there on the YouTube. Please check it. Garbhini Paricharya. Yes, I have taken it. Paricharya. Third chapter that we are taking today. Third chapter. Garbha Vyapad. Garbhasrava Garbhapat. Upavishtaka Nagodara. Leena Garbha and Mrita Garbha. Mrita Garbha. Dead. Fourth chapter. Fourth. Garbhopadrava. Complications during the pregnancy. That is Chardi, vomiting, hyperemesis gravidarum, first 2-3 months. Then Garbhopadrava Shotha. Shotha is edema on the body. Garbhopadrava Apasmar, epileptic fits, Apasmar. Then Garbhopadrava Pandu, anemia in the pregnancy. Garbhopadrava Prameha. Please write down. Gestational diabetes mellitus. Gestational DM. Garbhopadrava Prameha. Then Garbhopadrava Makkal. Garbhopadrava Makkal. Bahu Appatya or Anek Apatya that I have taken. Then Garbhashayetra Garbhadhan. Not in the pregnancy, doesn't take place in the uterus. Garbhashayetra Garbhadhan. Ectopic pregnancy. Ectopic pregnancy. Chapter number 5. Slow and steady. Write down. Chapter number 5. Prasava Vijnana. Prasava. Delivery. Prasava. Delivery. That is Avadhi. How much time? Kala. Garbha Asana. How should be the fetus inside? Prasava Hetu. What are the causes? Why delivery starts? Oxytocin. Prasava Avastha. Different stages in the delivery. Prajayini Avastha. Prajayini Avastha. Avi. Write down. Avi is equal to labor pain. Avi. Write down. Avi. AVI. Avi is equal to labor pain. मराठीमध्ये आम्ही त्याला कळा येणं म्हणतो. बाळंतपणाच्या कळा. पोटात असा स्पॅझम येतो आणि बाळ पुढे ढकलतं. So there is a spasm and the fetus is going out to the vagina. Then Prasava Vedana, labor pains. Sixth chapter. Prasava Vyapad. Vyapad means complications. Akala Prasava, premature delivery. Akal. Then Kalachita Prasava. After completing 9th month, 9 days, 10th one. So that is Kalachita Prasava. Then there Prajayini Avastha. Vilambita Prasava. Delayed. Vilambita Prasava. Garbha Sanga. Apara Sang, obstruction. Prasavottar Yoni Bhed. Prasavottar Raktastrav. And Kritrima Prasava Vidhi, caesarean section. Cutting the abdomen, baby is taken out. 7th chapter. Sutika Vijnana. After delivery, Sutika, puerperial period. Sutika Vijnana. What is Sutika? Sutika Paribhasha, definition. Sutika Kal. Sutika Paricharya Tattva. And Sutika Paricharya, lifestyle, advice. Chapter number 8, Sutika roga, the diseases during puerperial period. Sutika roga Vyakhya, Nidan causes, Sarvadehik Lakshana symptoms. Sutika roga, Granthokta Sankhya, how much numbers, and according to the Nidan classification. Sadhya Sadhyatva, prognosis. Samanya Chikitsa Sutra. Sutika Jvara, Jvara fever, puerperial fever. Sutika Shoth, Shoth edema. Sutika Makkal. Sutika Vidradhi or Rakta Vidradhi. Chapter number 9, Mooda Garbha. Mooda Garbha Vyakhya, that is definition. Mooda Garbha Vyapti, Mooda Garbha Kala, Mooda Garbha Hetu, causes, Mooda Garbha Samprapti, and Mooda Garbha Samanya Lakshana. Chapter number 10 from paper 1, Obstetric, Prasuti Vijnana. Family welfare concept, family planning, family welfare. National Family Welfare Program in India. Family planning, conception, birth control, use of condom, use of OC pill, oral contraceptive pill. The scope of family planning services, eligible couples, and Ayurvedokta Garbha Nirodh. So these are the important topics from paper 1. Let us start with the today's topic. Little pause. Garbhasrava and Garbhapat. Only few things I will ask to write down. The expelled fetus up to the 4th month is termed as Garbhasrava in liquid form. Please write down. Not whole sentence. You write down 4th month, dash, liquid, dash, Garbhasrava. 1st month, 2nd month, 3rd month, up to 4th month, if the only liquid goes out and pregnancy end, then that is Garbhasrava. Next sentence. After 5th or after 6th month, expelled fetus is termed as Garbhapat because it has attained stability. When Garbha, whose body parts are not conspicuous, not clear, is expelled, then that is called as Durdhara. Can you see? Durdhara. When a Garbha with complete body parts is expelled, it is termed as Kalratri. These are the Ayurvedic terms, Samhita. Durdhara, Durdhara, and Kalatri. But basically, you must remember up to 4 months, Garbhasrava. After 5th or after 6th month, Garbhapat. Okay, we will go further. What are the causes? We will discuss about the causative factors. Okay. First to para, Charak has mentioned 7 factors for this Garbhasrava and Garbhapat. There may be problem with the Shukra, semen, sperms, Asruka, that is the female side, female hormones, female ovum, Stri bija. Problem may be Purusha bija or problem may be Stri bija. Either spermatozoa defective or ovum is defective. Atma, then Garbhashaya, problem in the uterus, Rutukala, pregnancy period, Ahar and Vihar are responsible for the proper growth, development and delivery of mature fetus at term. If everything is okay, then normal delivery, no problem. But if there is a defect in any of these, then there is a miscarriage or abortion. So what should be the good? Shukra should be good. Asruk should be good. Atma should be good. Garbhashaya should be best. Rutukal best. Ahar Vihar best. Then no problem. proper delivery, best baby. Okay. Similarly, any abnormality in these factors may lead to improper growth and expulsion taken out before term due to the aggravated Vayu and other doshas. Vata dosha prakop with Pitta dosha with Kapha dosha prakop. So remember these 7 factors. At the moment, immediately write down. I will wait. 1, 2, 3, 4, 5, 6. Write down this way. One after another. One number. Are you writing? Shukra. Second, Asruka. Sanskrit. Atma. Soul principle. English. Soul. Soul. Fourth, Garbhashaya. That is uterus. Rutukala. Proper period. Ahara. Food. And Vihara. Lifestyle. I hope you have written down this thing. Now, from 4th month onward, after 4 months, until 8th month, if the pregnant lady is having anger, hot-tempered, grief, sorrow, depression, dissatisfaction, negative criticism, jealousy, fear, terror, excessive indulgence in coitus, sex, exercise, excess exercise, then suppression of natural urges, vegan dharayet, na vegan dharayet, vat, vit, mutra, shavat, trit, chudam, nidra, kasa, shrama, shwas, jrumba, shrut, chardiretasam. Oh my God, OMG. Some shlokas are very important. Suppression of natural urges. If I am hungry, I must eat. If the pregnant lady is having thirst, she should drink the water. If she has feeling to go to the toilet, go for defecation, go for urination. No stopping forcefully. Na vegan dharaye. Vega means natural urges. So that can create the problem. Sitting, standing, or sleeping in uneven posture. For example, I am sitting like this. Can you see me? Abnormal sitting. Sir is not sitting properly. Now, if I go back on my chair and straight, I am sitting, then this is the proper sitting. Are you getting? Then I am sitting like this. This is not proper sitting. So sitting, standing should be very correct. Okay? Uneven postures, wrong. Hunger or thirst, eating rotten or stale food leads to the abortion according to Ayurveda. Okay? Next. We are seeing the causes, nidana. Following factors may cause Garbhasrava or mood garbha. For example, excessive indulgence, doing the excess, coitus, intercourse, sex, traveling by chariot, horse riding, traveling by motorcycle, rickshaw, buses, ST, whatever our public transport on the uneven road. If the pregnant lady is traveling, chances of miscarriage, chances of abortion. Okay? Then stumbling, falling from the height, accidents, compression, running, injury, lying down or sitting in uneven places, unnecessary fasting, dieting, that is undernourishment. Then suppression of urges, vegan dharayat, consuming dry, hot, very, very hot, lot of time chilies and pickles, very bad for the pregnant woman. Okay? Pungent, bitter food, then having some psychological tensions, grief, alkali, then diarrhea, loose motions, emesis, purgation, taking the Durkulax tablet, taking the enema is not good. Without a prescription, pregnant lady should not do anything of her own. For anything, she must take the advice of the gynecologist. Okay? So swimming, indigestion, and abortifacients. That means the elements, the medicines which can cause abortion. Then here, Putragni, a typical name for the yoni, genital organs, Putragni, Vamini, or Astrij Yoni Vyapad also cause Garbhasrava and Garbhapat. As my student is studying the Yoni Vyapad, immediately after my lecture, you open the textbook and see this Putra Gni Yoni Vyapad. Then also check Vamini Yoni Vyapad. Also check Asrija Yoni Vyapad. Because these cases, these problems can give miscarriage and abortion. Garbhopaghatakar bhav. Important question for examination. Garbhopaghatakar bhav cause destruction and expulsion of the fetus. I have taken the lecture on Garbhopaghatakar bhav. You check your video. Okay? We will go further. Lakshana. When there is a miscarriage or abortion, what will happen? Just me make a very nice and decent concentrate on the marked portion. Lakshana, that is symptoms. Pain is felt in Garbhashaya. Lower abdomen, the lady will get pain. Oh my God. Then Kati, where is the pain? Pelvic region. Then Vangshana, inguinal region. Basti Pradesha, urinary bladder place, that is lowest part of your abdomen, lower abdomen, along with vaginal bleeding. Main thing, Garbhasrava Garbhapat, you write down vaginal bleeding is important. Please write down vaginal bleeding, very important. Vaginal bleeding, don't forget. Pain is due to Vata Prakop. Write down Vata Prakop. And Raktastrava is due to the expulsion of Amagarbha. I request, write down this word Amagarbha, immature. Amagarbha, immature fetus. And due to reopening of Artava Vaha Srotas. Please write down this word. Some keywords. Key means very, very important words. While giving the examination, if you don't write these words, you will not get pass. These are the minimum words. You must write down. Keywords, K-E-Y. This is the word. Artava Vahasrotas. This word is very important. Okay. Now, I will go further. That is the next chapter. Where it is that? Can I go like this? No, this is Zoom. But where is the next things? Okay. In that way, I will try to go. Move page. Okay. In that way, I will go in this way. Slowly and steadily. That is the better way. That is the better way. Okay. Now we are talking about the Chikitsa. This is the second page. Can you see? I will mark for you. Don't worry. Don't worry. Be happy. Chikitsa is a treatment or management for Garbhasrava and Garbhapat, miscarriage and abortion. According to Charak, what he has said, to stabilize the fetus, to prevent abortion. Try, don't cry. Try, don't cry. You must try to, what you can say, avoid the further progress of the miscarriage and abortion. Try to avoid. These treatments should be done immediately, very urgent, if vaginal bleeding occurs. Vaginal bleeding, Raktastrava takes place. What you can do, if there is vaginal bleeding during second and third gestational month due to unwholesome diet, improper diet, viruddha ahar, bad, and regimen, lifestyle, it is unlikely that the pregnancy will continue as the Garbha will lack the maturity. It will not get matured. Furthermore, Stambhana Karma. This word is very important. Cursor is there. I will dictate 3 times. Stambhana. Please write down. To stop. Stambhana means to stop. Stambhana, stop. Stambhana, stop. Stambhana karma to prevent Garbhasrava is considered as mutually contradicting as the Garbha is still in Ama Avastha during the 3rd month. Since Stambhana is done with Mrudu, Madhura and Shita Virya Dravya, which can increase the Ama. Okay, so this type of the Dravya sometimes can be used, but it depends. That means what is the stage? of that particular miscarriage. If it is going to happen, let it happen. But first, in the beginning, you can try with these dravyas, mrudu, madhura, and shita virya, pittagna dravya, because bleeding is always with the pitta dosha problem. Okay. Next, if there is a vaginal bleeding during 4th month or onwards, these are the management procedures. Number 1, position. The woman should lie down on soft bed with cooling bed spread so that the level of the head is lower than the foot end. Can you understand? Here is the pregnant woman's head and this is the leg. So below the that particular part of the leg of the bed, there should be some bricks or some support is given, and the lower part, that leg part, is up and head part is low. That is the typical position is given. Head is lower than the foot end. That position is called as a Trendelenburg position. Trendelenburg position. Trendelenburg position. I will wait. You write down. Cursor is here. Okay. Trende. Trendelenburg position. Trendelenburg position. A complicated word, but we have to remember that. That is, the foot end is up. Okay. Now, Bahya Chikitsa. We will go further. This word is also important. Yoni Pichu. Cursor is there. Cursor is there. Huh? Write down. Yoni Pichu. Pichu is a swab. Pichu is a swab. Yoni Pichu. Word is very important. Yoni Pichu. Cotton dipped in Yashti Madhu Ghrita, Churna and Ghrita. Please write down this word. Yashti Madhu. Very important. Easily available. Licorice. Jeshta Madhu. Yashti Madhu. Jeshta Madhu. Licorice. English word. Licoqu. Licorice. Next, Lepana with Shatadhauta Ghrita. This is very easy and easily available even today. So there should be Lepana. Please write down Shatadhauta Ghrita or Sahastra Dhauta Ghrita. Below the Nabhi, that means lower abdomen. You have to make a gentle, not rubbing, gentle application of Shatadhauta Ghrita. Then Parisheka, pouring of the liquid. Parisheka with Ati Shita Kshira. Kshira means milk. Please write down. Pouring with the cotton, with the cloth. Take with the oil or milk and pour it around the Nabhi. Okay. Yashti Madhu Kshaya. Kshaya is a decoction, but not hot. Never pour any hot thing. Cold. Then Nyagrodhadi Kshaya below the Nabhi. Otipot in Marathi, lower abdomen, above the urinary bladder. Snana with Shita Udaka. Always use the Pittagna Chikitsa. Okay. Can you see? Snana with Shita Udaka. Next, Yoni Pichu Dharana with, what is that? Kshiri Vruksha. This is a complicated word, but write down Kshiri with having the milk as a secretion. Latex. So that is a Kshiri Vruksha Swarasa and Kshaya Rasadravya. This Kshaya word is very important. Please write down. Kshaya. Kshaya is equal to astringent. Kshaya is equal to astringent, which is a vasoconstriction. Always, whenever there is a bleeding, anywhere, anytime, with male, female, but there we need the Pittagna Chikitsa. What is the principle? If somebody asks you what you are doing, Pittagna, anti-Pitta treatment, anti-heat treatment, and Stambhana Chikitsa. Stop. And what is that? Kshaya Rasa. Kshaya is a astringent vaso. Write down. Kshaya. Astringent. Write down. Vasoconstriction. Blood vessels become narrow. Bleeding will stop. Yoni Pichu Dharana. Holding the vaginal swab with Kshira, milk. Ghrita. Medicated ghee. Boiled with Nyagrodha Shunga. Okay, next we will go. Now there is a Abhyantara Chikitsa. We are talking about Garbhasrava miscarriage and Garbhapat abortion. Internally, Abhyantara means internally. Nyagrodha Shunga processed with Kshira milk, medicated milk, or Ghrita, medicated ghee. 1 aksha is equal to 12 ml. Then you always use the Kshira and the Ghrita, Rasayana Dravyas, anti-aging, anti-destruction, layer, Satan, layer, prepared with, what is that? Padmaka Kshar, Utpala, Kumud, lotus, Madhu, honey, and Sharkara, sugar. Next, Kshira, boiled with Priyangu, Utpala, then Udumbara Phala, and Nyagrodha Shunga. That is Kshira boiled with medicated milk. Then Mrudu, Sheet, Sugandha Raktashali with Madhu, honey, Sharkara, sugar, and Kshira, milk, boiled with Bala. This is the name of the plant. Atibala, Shali Moola, Shashtika, Ikshu, sugarcane, and Kakuli. Whichever the dravyas are available, you can use that one. Nidana Parivarjana, most important. This Nidana Parivarjana, you can write in any disease management. Any disease management. Because this is the first principle of Ayurveda. I will tell you the one line, one shloka, that you have to write down in Roga Nidan, in Chikitsa, in Striroga, in Balaroga, any disease. You write down this line, you will get mark. You will get the good marks. What is that line, sir? Are you ready? Write down. Sankhepataha. Sankhepataha. Kriya yogo. Nidana. Parivarjanam. Don't worry, I am repeating 10 times. Sankhepataha. Kriya yogo. Nidana. Parivarjanam. Again, come on. Sankhepataha. Say with me. Sankhepataha. Kriya yogo. Nidana. Parivarjanam. When I say chant the mantra, you have to chant with yourself in your house and loudly. Sankhepataha. Kriya yogo. Nidana parivarjanam. Sankhepataha. Kriya yogo. Nidana parivarjanam. Sankhepataha Kriya Yogo Nidana Parivarjanam. Sir, what is that? Yes, I am telling you. Ayurveda says Ayurvedic treatment means Sankhepataha. In short, Nidana Parivarjanam. Stop the causative factors whenever possible. If you know what are the exact causes, stop it. For example, if that pregnant lady is going to the office every day with the Activa, with the some vehicle, stop. Don't go to the office. Take rest 1 month, leave, bed rest. That is called as a Nidana Parivarjana. If you give this swab, if you give this medicated milk, if you give the lay, satan, but the lady is going immediately to the office, no use. No use. Because first thing, stop the causes. You are giving this very good treatment, Nagrodha Shunga, Kshira, Ghrita, what is that? Medicated milk, Leya, everything you are giving. But the lady is every day eating vada pava with chili. Garbhasrava Garbhapat will not stop. It will happen. So, Sankhepataha Kriya Yogo means Chikitsa. Nidana Parivarjanam. Stop the possible causative factors. I think I am going very slow and comfortably, making you confident about Ayurveda, about Prasuti Tantra. Okay. Next. That's why I request all my viewers, share with your friends in the colleges and make them understand Dr. Deshpande is telling fantastically with action. Spread this video and see the video from first to last. Then only you can learn. This is not your reels, funny reels. No, this is not fun. This is education. So be serious and see the video till end and 100 times. That is will be beneficial for you. Next problem, Garbha Vyapad. Garbha Shosha. Here. Just wait. Garbha Shosha and Garbha Kshaya. Acharya Sushruta is saying that absence of quickening and decrease of abdominal height are the two features of Garbha Kshaya. The growth is not proper. Fetus inside the uterus is not developing. Growth is not proper. That is Garbha Kshaya. Then these words are important, so write down. Cursor is always there. I am making the cursor. Quickening. Sir, what is quickening? What is quickening? That baby inside the uterus kicking the mother's abdomen. Kicking the mother's abdomen. आम्ही मराठीत त्याला लाथ मारणं म्हणतो. लाथ. That is quickening, movement of the baby with the legs. So that is quickening. Don't forget this word, quickening. That will stop because the baby is not growing well. And also decrease in the abdominal height because it will show baby is shrinking. Bad luck. Okay. Treatment. During the Basti Kal, that is the 8th month of gestation, Kshira Basti is always given. Kshira Basti, Bruhana Basti. Please write down. Bruhana. Cursor. Can you see the cursor? Kshira Basti with milk, along with intake of, that is Medhya Anna, that is Snigdha Ahara Dravya or cereals mixed with a Ghrita. Best Rasayana, Ghrita, ghee. Now I will go further. Next chapter. Next page. Another problem. Next problems. Upavishtaka and Nagodara. First, we will try to understand. Write down the title, Upavishtaka. First, we will see what is written and then we will discuss. Upavishtaka and Nagodara are the conditions in which doshas get aggravated. Vat, pitta, kapha, aggravated due to the improper intake of ahar, food by the mother, which ultimately leads to the growth and developmental delay. Not proper growth, no proper development, or drying of Garbha. What is the word? Drying, dry. Drying of Garbha resulting in prolonged intrauterine stay. So these things are happening. First, growth and development. You write down these things. Upavishtaka and Nagodara. Cursor is there. So easy to write down. Growth and development delay. Of what? Garbha, fetus. Growth and development delay. And this word is important. Please write down. Drying, dry. Ruksha. Snigdhata is gone. Unctuousness is gone. Lubrication is gone. Nourishment is gone. Shishka. Okay. Now we will talk about the Nidana and Samanya Lakshan. Nidan Samprapti, just here only, here. Okay. Can you see? When a pregnant woman is taking the diet and regimen, lifestyle, contraindicated to the pregnancy. When we want the stability, when we want the growth, which dosha is important? Yes, kapha dosha. Stability, growth, kapha dosha. Stability, growth, kapha dosha. Am I right? But when what is the properties of kapha dosha? What is the properties? Snigdha shito gurur mandaha shlakshana sandra mrudus sthiraha. Snigdha shito gurur mandaha shlakshana sandra mrudus sthiraha. These are the properties of kapha. So this should be followed. But lady is not following. She is not taking snigdha. She is taking ruksha, food. The kapha is a shita, nourishing, but she is taking very hot chili, spices, pickles, all these things, raw mango pickles, garlic pickles, mixed lonche, pickles, mixed lonso, pickles, that is chutney, chili ठेचा, हिरव्या मिरच्याचा ठेचा. In Maharashtra state, Kolhapur city, there is tamda rassa and pandra rassa. Oh my God, very hot. Don't take it. Pregnant lady should not take that. If she takes ushna, hot, in lot of tea, lot of coffee, foreign alcohol, drinks, not good in the pregnancy. Katu, spicy, tikshna dravya with, what is that? What is that? That is 4th month of gestation. If she takes after that sanskar, after that 4th month, then that is the problem. It leads to the vaginal bleeding or abnormal vaginal discharge. Vayu is vitiated, which in turn, first Vayu is getting disturbed. It disturbs to Pitta, it disturbs to Kapha also. So all the 3 doshas, the aggravated doshas, cause obstruction in Rasa Vaha Nadi. Please write down this word. This cursor is there. Cursor is there. Rasa Vaha Nadi. Rasa Vaha Nadi obstruction. Rasa Vaha Nadi obstruction. And so Garbha is not receiving proper nourishment. Therefore, the growth and development is delayed and intrauterine stay is prolonged. This condition is known as Upavishtaka. If you want to write down, again you can write down, first write down this word. Upavishtaka is equal to. Upavishtaka, 2 lines, is equal to, here you write down. What is that? Growth and development is delayed. Cursor is there. Growth and development is delayed. And second thing, here, intrauterine stay is prolonged. That is called as Upavishtaka. Generally, next, if the Nidan, that is causes, includes Vata Prakopa Ahar and Vata Prakopa Vihar, along with avoidance of Sneha Dravya, no milk, no ghee, Ruksha Guna of Vat gets aggravated, which causes the drying of Garbha and reduction in the abdominal size. This condition is known as Upashishka or Nagodara. You must differentiate. This is Upavishtaka. Don't get confused. Upavishtaka, underline spelling Upavishthaka, Upavishtaka, 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 and this is Upashishka, Upashishka or Nagodara. So in Nagodara, Nagodara is equal to, please write down, drying of Garbha and reduction in the abdominal size. Okay, we will go further. Okay. Bheda and Lakshana Chikitsa. I'm sorry, I think this is not good. I don't like this. I will make a broader. Oh my God. I will go back again. I will go further, slowly up. Okay. I will try to mark. I'm not sure about it, but I will try. Okay. Okay. Bheda and Lakshana and Chikitsa. When there is a Vata dominance, Pitta dominance, Adhikya is a dominance with compared to another 2 doshas. My Vata is more than Pitta and Kapha. Here, Pitta is more than Vata and Kapha. Here, Kapha is more than Vata and Pitta. Okay? Comparatively. Vyapadeshastu bhuyasa. Okay. Purisha is loose motions. Purish means stools. Fragmented, frothy, and expelled with sound. Okay. Then Mutra Sang, obstruction to the urine. Then Vedana. Always Vata means Vedana. Vata, Vedana. Vata, Vedana. Whenever in any examination, any subject, Some terms are very important. Vat is equal to Vedana, Pitta is equal to inflammation, and Kapha is equal to edema. Edema, Shotha. Remember these terms. So Vedana where? In Kati, pelvic region, Prishtha, backache, Hridaya, in the chest, Jrumba, yawning, Nidra, Nash, insomnia, Pratishaya, watering from the nose, Shishka Kasa, dry cough, Sad, debility, weakness, Glani, drowsiness, fainting attacks, itching in the ear, pricking pain in the temples here, cutting pain in the abdomen, blackouts, black in front of the eyes, indigestion, emaciation, weight loss, dry, cracked, rough, and discolored skin. So this is Vata dominant case is there. What you can do? Whenever there is Vata, always treatment will be Basti. Correct? So you must, I will also mark for you this. I'm sorry. Chikitsa. Immediately after Vata, we will complete Chikitsa. Basti with Saindhava Lavana and Kshira. Then Shita Udaka Snana. Okay, when there is undernourishment. Mrudu Shali for eating. Rice. Mudga Shali, Mrudu Shali. Then Anuvasana Basti. Only with the fat substances, either ghee or oil. And Vidaryadi Ganadravya. Siddha, that means Grita will be processed, Sanskarita, with these particular medicines. Herbs. Living a place sheltered from wind. There should not be too much wind. One should protect from the wind because this is Vata problem. Now we will talk about Pitta problem. From here to go, we will go down, right? Pitta dominance. Purisha, stools will be coppery green, feeling like mouth and throat is filled with smoke. Very hot. Like fumes are coming from your mouth. Pittaja. Amla chardi, sour, vomiting. Murcha, fainting attacks. Dah, in Kukshi and Hriday, chest region and abdominal region. Red or yellowish discoloration of the eyes, nails, and urine. Discoloration, yellow coloration, red coloration. Blackening of skin, weakness, and continuous pain will be there. What you can do? Yogurt, Yavagu, cooked with Aja, Ghrita, and Kshira. Mainly you can remember the milk always. Pitta, milk. Okay? Then Jivaniya Dravya, Ghrita, cooked with Kshira. Then Payasa Kalka, Kakoli, Kshira Kakoli, twice daily, morning and evening, along with the Mausarasa. Okay. Now we will go with the Kapha Adhikya, that is the dominance. We will see. What are the symptoms? Sorry, my dear friends. Kapha, come on, Kapha. Madhura Asya. Sweet taste, not proper, improper. Utklesha. Nausea. Nausea. Feeling like vomiting. Nausea. Then Shleshma Vamana. Directly vomiting. Shleshma with sticky cough. Then Bhakta Dvesh. Not want to eat. No eating. Anorexia. Bhakta Dvesha. Then Shweta Hastapada Netra. Hands and feet and eyes will be cold. Kas and Shwas with lot of cough. Here, dry cough. In Vataja, here, dry cough. Here, wet cough, W-E-T, that is cough with expectoration. What you can do? Anupa and Audaka Mamsa is given for 7 consecutive days by making it appetizers with spices. After that, Sura, medicated wine should be given. Then churna of Tila, Mudga, green gram, Masha, black gram, Lavana, and Bilva Patra mixed with Ghrita should be taken along with the boiled and cooked Aja Kshira. Aja, goat milk. Goat, not cow milk. Goat milk, not buffalo milk. Goat milk. Aja Kshira, Aja Kshira. Okay, now we will go further slowly and steadily. If Garbha fails to develop in spite of all this treatment, then it should be terminated or aborted with Tikshna, Virechaniya, and Apara Patana Dravya. You have tried your level best. You have tried it, but no success. Again, you do the sonography, but fetus is not growing. Then what to do? You cannot keep that dried fetus inside. Then you have to abort therapeutic, medico-legal, medical termination of pregnancy. We have taken that lecture, MTP. MTP, medical termination of pregnancy. When this, all the treatment, all your efforts to save that baby is not successful, then you have to use what you have to use? Termination with Tikshna, Virechaniya. This word you write down. Apara Patana Dravya. Can you see? Apara Patana Dravya. This one. Okay? Okay. We will try to go further. Leena Garbha. Next. Leena Garbha. What is Leena Garbha? Due to the obstruction of Yoni Marga, vagina, and abnormalities of Srotasa caused by Vata dosha, the Garbha shrink and adhere. It becomes inactive and does not quiver. It will not show any movement. It is forced to stay inside the uterus by a long time, resulting in intrauterine death, IUD. Before that, before directly IUD, there is one stage that is called as a Leena Garbha. What you can do? The pregnant woman is given Mrid, Madhura, Sheet, Snigdha Ahara, Rakta Shali, rice, cooked with Yusha, prepared from mash, mulak, and large quantity of ghrita. Lukewarm oil massage in the lower abdomen, very gentle massage. Groin, thigh, waist, flanks, and back should be done frequently. Mrudu Svedana, Mrudu Vamana, and Virechana with plenty of Sneha Dravya. But this is not practical. Nobody gives the Vamana and Virechan when there is a Leena Garbha in practice. Rather, nourishing treatment one must try. But again, if it fails, one cannot help. Okay? Then what will be the next step of Leena Garbha? That is Antah-Mrita Garbha. Can you see? Antah-Mrita. Dead. Fetus is dead. First, we will see the Antah-Mrita Garbha is the death of the fetus inside the Garbhashaya. That is uterus. It is IUFD, intrauterine fetal demise. Can you write down this word, please, myself? IUFD. IUFD. Intrauterine fetal demise means death. Nidana. Nidana means, yes, causes. Hetu. When there is excessive accumulation of dosha, excessive use of Ushna or Katu Dravya, Vega Sandharana, that is Vata Vega Dharana, Vit Purisha Vega Dharana, Mutra Vega Dharana, sitting, sleeping, and standing in improper posture, increase in intrauterine pressure, injury or trauma, psychological factors, anger, grief, jealousy, fear, frightening, overexertion, then the Garbha will die inside the Kukshi. This is also called as a Garbhopaghatakara bhav. Garbhopaghatakara bhav, damage to the fetus. What are the Lakshana? Stillness, no movement. No movement, still, no heart sounds, stiffness, tightness, coldness, severe pain, absence of fetal movements and contractions, no vaginal discharge, laxity of the eyes. This is about a pregnant lady. Blackouts, dark, giddiness, Brahma, giddiness, dyspnea, breathlessness, discomfort in the abdomen, natural reflexes like bowel and bladder are disturbed, blackish or whitish discoloration, and mainly foul breath. Now here we want to give the treatment for this intrauterine death. Can you see this? Apara Sangha Chikitsa. Treatment of retained placenta is given. Then What is that? Atharvaveda mantra, chanting of the hymns from the Atharvaveda, 4 Rigveda, Yajurveda, Samaveda, Atharvaveda, you know that. Huh? Then Shalya Harana, extraction by an experienced surgeon. Okay. Amagarbha. What is Amagarbha? This is for the oral. Please write down this word, my dear friends. Amagarbha. Amagarbha. After expulsion of Amagarbha, that is immature fetus. This also you write down. Immature fetus. For cleaning of the uterus, soothing the pain and elevating the woman's mood, varieties of madhya, medicated wine, Ayurvedic, are given according to her pregnant woman's strength. The Brahana and Santarpana Yavagu is given. The regimen is followed till the clade of dosha and dhatu is clear. Later, Dipaniya, Jivaniya, Bruhaniya, Madhura and Vatahara Dravyas are processed with sneha, that is, of course, the ghee, and should be given as a abhyantara snehapan. Inside, ghee, medicated ghee, basti or along with this ahara. Then, what is that? Pakva Garbha. This was Ama Garbha. This is Pakva Garbha. In case of Pakva Garbha, that is matured fetus, Sneha is prescribed from the day of extraction of the Mrita Garbha. When you take out that Mrita Garbha, then the lady is given again some Sneha Dravyas to maintain the nutrition of her own. Okay. So in today's lecture, Dr. Deshpande has discussed about Garbha Vyapad, like for Garbhasrava Garbhapat, Garbha Shosha, Garbha Kshaya, Upavishtaka Nagodara, Leena Garbha, and Antah-Mrita Garbha. So thank you very much. Because the time is up, tomorrow at 7 p.m. we will discuss about Kaumar-Bhritta Tantra or Ballroom. Thank you very much for patience hearing. But don't forget to subscribe my YouTube channel and circulate these videos to all your college friends. Thank you very much and take care.